Hello guys, welcome back again to my YouTube channel. So this is Paulo Bridge, your Pinoy nurse here in Singapore. So for my today's content guys, I'm going to share to all of you what are the top priorities in Singapore hospital. Or also we can say Singapore hospital top priorities. Also we can say top priorities in Singapore hospital. Later I will tell you guys what do I meant about this content. Okay, but before that, don't forget to like, share, and subscribe my channel. Okay, don't forget to like, share, and subscribe my channel. So for this content, guys, it is very helpful, especially if you're a newcomer here in Singapore, and also if you have plans to work here in Singapore as a healthcare worker, not only for nurses, okay, for health workers. Okay, so yes, I made a list again regarding this content. So I made a list the top priorities in Singapore hospitals. So what do I mean about this? It's what are the things that Singapore hospitals are extra careful of? I mean, what are the things that they are very careful, very careful? Yeah, extra careful. So I mean, it's not only making our patient well. So there's a list that what I observed that they are extra careful. So this content is based on what I observed and based on my experience here in Singapore. Like you all know, I've been like 13 years here in Singapore. Okay, so this is based on me. Okay, it's up to you if you want to follow or not. But yes, I'm telling you, this is very helpful, especially if you're new here. Okay, so first in my list is fall. Fall. Yes, fall is quite a big issue, especially if it happens on your shift. Okay? Yes, it's quite a big issue. You need to raise incident report, or especially if example patient develop like fracture, then something more serious thing that happens to the patient, then you need to file what they said, SRE, serious reportable incident, something like this. Yes, fall is, I notice, is quite big issue here. And but my main tip about this fall thing is, yes, as long as you do all your fall preventive measure, then your manager or the hospital itself will protect you. Make sure that you follow all the fall preventive measure. And I won't discuss this fall preventive measure. I know you all know about this, but also one of my tip, it's quite common, especially in geriatric patient. So of course, geriatric patient, like those suffering from dementia, Alzheimer's, and their bones are quite fragile already. So yes, and those having postural hypotension, like their BP is dropping immediately, then yes, fall can occur. Okay, guys, make sure you remember this. Fall is quite. They are really extra careful about this. Okay, that is my first in my list. Second in my list is, yes, I made the list. This is very, of course la, medication. Yes, they are extra careful about this when giving your when you're serving medication to the patient. Yes, make sure that you remember your five rights of giving medication. Not only five, actually it's 10. So I won't tell it anymore what are those 5 and 10 rights. It's, you just search it, 5 rights and 10 rights in giving medication. And yeah, um especially when you're giving controlled drugs, you need, they call it like dual sign off. You need two nurses to double check if you're giving it correctly. And not only controlled drugs, those HAM, so high alert medication, this list of medication, you need two nurses, like, to see that if you're giving it correctly. You need dual sign off. Two nurses must be there to check. And also, like for those IV medication, if like you need to know what are the diluent and everything, they have this dilution chart that you can search in the computer, then you just follow it. Make sure, by the way, my tips, make sure you check if like nurses are allowed to give or only doctors. You can see, it's quite hard to show, I mean, to for you for now to figure it out, but there is that they call dilution chart, which is, yeah, you can search all the IV meds, and they will instruct you what dilution you need to use and who can serve, etc. and etc. My tips about this medication thing: if you're not sure and if you haven't encountered that medication, of course you search, okay, and always ask your senior. Don't just anyhow like be so proud like you know this medication, etc. My tip is, yes, search that medication so you will able to understand more about that medication. And yes, and also I noticed here in Singapore, pharmacy is always involved. So before, by the way, guys, before we can serve medication to the patient here, example, doctor will order a medication right in our computer system. Pharmacists will see that order, and they will counter check it first. So we need to wait for the pharmacy to verify it first before we can serve it. Not also, and also our task is, of course we cannot anyhow just give the medication. If you're not sure, if you think the medication is incorrect, then you need to highlight with your doctors, etc. and etc. I think that's for the medication thing. Okay, that is second in my list. Medication. Third in my list. Yes, third in my list. Okay, this is what you call pressure injury, sacral sore, broken skin. Yes, yes, guys. This is quite important also in hospital. So we are preventing developing pressure injury, sacral sore to our patient, especially for those bedbound patient. So make sure you do all your preventive measure like turning, applying air mattress. Make sure you do that. It's quite a big issue. If example, a patient develops sacral sore during his or her hospitalization because means you never take care properly your patient. And also not only pressure injury, especially or those who have developed contact dermatitis or like IAD. I forgot what's the term. Like those like if, especially if patient have frequent passing motion or urinating, then they will develop like contact dermatitis on their groin. So of course also this is issue. And what else? Yeah, broken skin, especially for geriatric patient. You know, like those elderly patient, their skin are quite fragile, very thin. You need to be extra careful when handling them because sometimes like just you just touch them and it will develop broken skin and already. So that is like for elderly. That is my tip. So you need to handle them TLC and make sure you do all your preventive measure so that our patient won't develop pressure injury. Okay, that is for that third in my list. Pressure sore, broken skin. Fourth in my list. Actually, fourth in my list is infection control. Actually, it's quite broad to explain. Yes, but yes, even haven't this COVID haven't started, they're already quite strict about this infection control. Okay, not only because COVID has is happened, even before they are quite strict about this. So infection control. What are my tips? Make sure that you know how doffing and donning your PPE, and of course your 5 moments of hygiene, seven step of hand hygiene. To be honest, I'm not really good about this, but yes, like what they said, practice what you preach. But of course, I'm preaching, but you don't know if I. Yes, but you need to remember all of this. Infection control is quite. They are quite strict about this, and make sure you know all those precaution like contact precaution, droplet precaution, and everything. Yeah, isolate. Infection control. They're quite strict about this. Okay, so it's good for you to read up, especially infection control thing. Okay, infection control syllabus. So something like that. Okay, make sure that you refresh yourself regarding this infection control. Fifth in my list, yeah, I included mental health. Yeah, recently I noticed that quite they giving importance already in staff mental health, and it's good that they are doing this because of course not only of course if the staff itself is burnt out, how this staff can take care of patient, right? So yes, I notice, yes, mental health also is important. Mental health is important in, I notice in Singapore hospital, they will do some program like outreach program, send their staff for bowling, etc. and etc. So yeah, mental health is quite important also here in Singapore. Okay, that is number one. Number five in my list, mental health of the staff. Okay, so tell me, by the way, those who's been working here in Singapore, is it true? Mental health now here in Singapore, is it important? Comment down below, okay? Number six. Okay, because like for those who've been following my content, I never worked in Philippines before, but I noticed here in Singapore, safety of the staff also is a priority. Like example, those relative of the patient, like or also the patient itself, like violent to the staff, we can call security immediately, which is I find it quite nice. Of course, like we feel like secured, like if any violent patient or violent relative, we can call this number and the security will come up. Yes, safety of the staff also is important. Okay, that is six in my list. Number six in my list. Seven. Okay, two more. Okay, number seven is discharge planning. It's very important also here regarding the discharge planning. I noticed like they will discuss what will be the plans, who will take care of the patient when he go home. Especially, Singapore is like aging population, right? And those elderly, we will plan who will take care when this patient is discharged. Can he cope alone, or does he requires a helper, or does he requires like his children to take care of him, etc. So discharge planning is quite important. It's very important also in Singapore hospitals. So we will plan this. So either, especially we will make sure that the patient when discharged, they are safe. Okay, that is for the discharge planning, especially for those frail patient that end up like nobody will take care when they go home. So we will make sure that they can cope whenever they discharge in hospital. Okay, that is number What number is it? Number 7. Okay, number 7. So last in my list is PDPA, Personal Data Protection Act. So this thing is like more on confidentiality of the patient, and yeah, of course they are quite strict about this, especially like because here is quite high tech, right? We have computers. They always make sure that we need to log out our account and everything, and you cannot just anyhow display a patient NRIC. NRIC is their, what do you call that, is they, it's like the ID number in Singapore. So yeah, it's important that we protect the data of the patient, and of course, yeah, it, you will be penalized if you didn't do this PDPA, Personal Data Protection Act. So you need to follow accordingly. Okay, that is last in my list. Okay, so I hope this content, guys, helps you to um, cope well. When I hope this not cope well, it's like it. I hope this content will help you. Yeah, that's the thing. I hope this content will help you. I cannot, I cannot explain further about this lah. So continue watching my blog, and I appreciate those who are watching, and that's it. So see you again. I will try to upload new one soon. Okay, so bye bye.